Welcome to another Rhodes podcast where we have a chance to meet our account executives. And today we have Mr. Paul Alexandre. He's actually one of our newest account executives, about to hit his 90-day mark, to get out of the cage, start using his benefits. But Paul, welcome to the podcast. I really wanted to bring you on because I think you have a lot to share and a lot of joy to give. So please introduce yourself and tell us a little bit about Paul and how you got here today.
Hello, everyone. Thanks for having me. Well, been around the industry for a while. My wife's been in the industry, and I was with ALF, and with that, and I was looking for a company to allow me to be in the front side of things. So I was able to join one of the best company that so far that I have, and I'm here.
And a lot of people don't know what ALF is out there because we like to use our abbreviations. But Paul comes from one of the biggest assisted living facilities
In South Florida, yes.
out here in South Florida. His wife, tell us a little bit about your wife because that's how you're tied into the game a little bit.
Of course. She's been in the industry for over 10 years. She is actually grew with the ALF assisted living facility.
Your wife's a nurse, kind of worked just from the facility aspect, and you wanted to come out and be on the other side, actually, where you're communicating with the accounts. You get to deal with the patient themselves. And tell us a little bit about that.
Well, I actually enjoy talking to people. One of the greatest things that I enjoy helping other people too. So it's one of those benefits to be able to help people and also to be able to feed your family at the same time. So giving to see families in difficulty, especially in that time after being in the hospital for a while, they're looking some to help their loved one, and then having the opportunity to help them. That's actually a lot of joy.
And that's actually a word that keeps coming across a lot during these podcasts and what we do. It's genuinely enjoying what we do. And if you don't have the why or the energy within inside of you to push you forward for this role, you're never going to be successful.
Of course.
So you're at the right place. I think your background and family and friends and what you've lived around is a perfect mix and match for this type of role and position. And I know that podcast can be a little nervous. I think this is my sixth one, and I'm still a little nervous, but I try not to be. So it's perfectly okay. Don't worry about it. No one's going to see this, Paul. So just be yourself and tell us about yourself. So thank you for coming on. I really wanted to highlight not just experienced account executives that have done this for 25 years, not just account executives that have done this for multiple years, but also an account executive that just started doing this, that's never done this. Tell us, what is the role like when you joined? Like, what was the first week like? How has that progressed within the next few weeks? Tell us what you thought before you jumped into the role and now what the role actually is. Like, what did you think it may be and what did it actually end up being? Because a lot of people are going to watch this that have never done this. They want to jump into sales, they want to jump into medical sales, and they're going to look to you.
Well, in the beginning, get to talk to you, my first conversation, it was a lot of information and it was a lot of wealth. But to be able to go out there the first week, it was like, okay, it was nervous, of course, and getting to get your spill out. But within the first, second week, it's just go out there and make friends. And that's what I learned. To when you get to talk to the different offices you go to, try not to be a salesperson, but to have the human part. And that's one of the things that helped me a lot is to be able to be the human part. And when you visit those facilities or those doctor's office.
And we kind of talk, and we say this a lot all the time, get uncomfortable to get comfortable. And the only way you're going to get comfortable is by getting uncomfortable a bunch of times. When you do something 100 times over, you become better at it. For example, you the first week or the second week when you're out and about and they ask you, what insurances do you take? But that evolved very quickly into a much smoother conversation hey, here's our insurances, but it doesn't matter what insurances we check because Paul takes everything, right? Here's our clinical services that we offer. Here's how we stand above the rest. Here's what you should be looking for in a home health agency because it's not the features of whatever home health agency you're working with, is the outcome of working with us, the outcome for you, your facility, and how things will end for you if we are the ones to be chosen. And not just for you, the facility, but also very importantly, the patient.
And of course, one of the things I appreciate with this, with us here in our team, is patient first and thinking about the patient, what best for the patient. We all want to have to give our services, but yet is it the best fit for our patient?
Correct.
So once we've making it sure that we are the best fit for our patient, we want to give our patient our best. And one of the things I like to describe Rhoda as is we're a big family, and the more patient we have, is more people adding to our family. I remember my first patient and that I've encountered. Of course, I was nervous making the first call. Now, I could say she's one of our family now because when we get to check on them, talk to them, patients become our family.
And if she has any questions or issues, this patient that you speak of, I'm sure you're the first person that she calls and that she feels comfortable with.
One of the first thing I told her was store my number in her phone, and she did, and she's been using it ever since. Every time she have any questions, the nurse come out, and after the nurse comes, she'll give me some feedback, and of course, talk to me about her day, of course.
I mean, we say this a lot with our account executives. You're the first voice they hear. You're the first voice they hear when their journey begins, and this journey has no end. It's an ongoing lifestyle change for them. Um, them being comfortable is priority for us,
Of course.
which I think home health beats outpatient clinics 24/7 because at home they're comfortable. At home, the care and the outcomes for those patients are statistically higher. So I'm very happy that you joined our team, and I can't wait to see how things will progress, blossom, and grow. I think you're probably going to be one of our best of the best. I think you have an insight into the assisted living world, how they function and how they work, that you and us will be able to partner with them and grow with them and give their patients more care and services. As you know, assisted living facilities or skilled nursing facilities, they might have an on site gym where they do a little bit of the physical therapy or rehab. Um, but that's nothing compared to what a home health agency can do and what we can service. I mean, a lot of people don't know a lot about insurance, but there's Part A and Part B. And long story short, Part B, when you build Part B, you're only getting a certain amount of care, maybe 1 day a week they get some physical therapy because that's the only thing those facilities can provide. But billing Part A, they can get multiple treatments a week, a lot more care. It's much better for the patient and their outcome. And you teaming up with those assisted living facilities and providing that value to them as a resource, then now we can provide more care for your patients. We can use the same nurses that you have on staff. I think is going to be a beautiful thing, not just for you, not just for the facilities, but ultimately for the patients, because they're the ones that are getting the more care for the same buck or the zero buck, because it's all through insurance. So I very much look forward to your growth when it comes within that sector.
I'm looking forward to it too, and then again, to be able to help our patient and give them the best that they can
A
get.
100%.
That's what we're here for.
Paul, what would you say is a common misconception or something people are confused about when it comes to home health? And this can be from a patient perspective, it can be from a facility perspective. What's something that people have wrong when it comes to home health?
Um, there's a few, but one of them is when a lot of the patients, they sometimes they would rather go elsewhere if they can than having people come to their home.
Okay,
If
that's
they
common.
if they haven't had that experience, they're assuming that it's going to be a lot on them. But when they get that, our nurses will go out there, put them at ease, and see how well they interact with them. So that when once they have that first experience, it changes the concept for them.
And it's quite common, and this comes up a lot. It's come up almost in most of our podcasts, where they think that outpatient treatment tends to be better, um, more continuity of care, things of that nature, when it's literally quite the opposite. With home health, you're going to get the same nurse, you're going to get the continuity of care. Uh, the key here, when you get the same nurse, you're going to build a relationship and a friendship with that person. They're going to become a family member almost, just like your patients are starting to become friends and family members of yours. The very same thing happens with the clinical team. That's not going to happen at a facility. The facility is going to have rotating physicians or clinical staff,
Yep.
and clinical staff doesn't stay at the same facility forever. But nurses, our clinical teams, because they work on the road, they don't have the same office. Once they establish a patient population, they're good to go. They work from home. They make their own schedules. They tend to much less rotate than they would at an outpatient facility. So that ultimately affects the patient and the outcome. So I think you're very correct there. Um, what do you do when someone feels lost? And when I mean someone, I want to talk about the facility. A facility maybe thinks they have to send a patient to a home health. They don't even know where to start, who's going to even take it. Do they even take that service provided? Are they even legally licensed within that county? Tell us, how do you keep, you, Paul, how do you keep the facilities from feeling lost or confused when it comes to placing a patient?
One of the things is when I introduce myself, I like to say I'm here to help. And that's one of the things that I want to do, be a resource for that facility or for that doctor's office. So let's just say they have a patient, it's Friday evening, they don't know where to put them. Maybe they have insurance issues. They're one of the things I say, hey, send them to me, and you have no worries.
Yep.
And of course, you'll have a result by Monday. That patient is being taken care of. That gives me an opportunity to not only, if I can't take it, to just check on my network, check on my resources to see who can take it, and I can make sure that not only that the office is good, but the patient itself have the right place and the right fit for their health.
100%, especially if they're trying to leave the facility or get discharged back to their home over the weekend, or if it's a holiday weekend, you name it.
I'm smiling because that same thing happened this weekend while my family and I was away for a little getaway, and we had a patient that since Thursday we've been in contact, and she wants to leave the hospital, but they couldn't find a nurse to be able to assist for that. And of course, it was Mother's Day weekend, and it was difficult. So while I was out with my family, I was interacting with the hospital itself and the patient and the patient's wife just to make sure that they were getting the right fit. So we
Yeah.
were able to find someone, and then now he's at home being taken care of. So that's one of those things to make sure that you are that resource for that facility. Despite what are you doing, whatever you're doing, just to make sure that you can help.
And you said this at the beginning, it fills up the heart and the soul. Because, like, the why again behind it, why are you really doing this?
Of course.
Because if you didn't care, you could be a mechanic or whatever else. But I mean, this is why I do it. This is why I love it. This is why I'm passionate about it. And I think the why and the passion and the expertise, the care behind it is what comes across and is seen most. Not just the accounts, but also the patients.
And one thing I would say, Roman, and that I appreciate too is my mother's an age. She's she's getting older, and we're a big family. So a lot of time I'm seeing myself, in place of those family, seeing what's happening with them, knowing that that could be me too. So
100%.
empathize with them, to be able to see yourself with them. That's one of the things that motivates you to do it. I mean, sometimes you could just not having the motivated to do it, but knowing that at all time they're at their all time low, they need your help.
100%.
So that's what one things that motivate me to continue at it.
And what would you say? Why would, I mean, this is just now a Paul question, and you might have touched on it a little bit. Why would a facility pick Paul over, let's say, Judy, the famous Judy that I like to use? Why would a facility pick Paul over Judy?
Of course, we were staying away from Judy for a minute. But the team that we have here at the Roads is one of the things that's empowered me too to
Yes.
do what I do. The intake teams and everyone else, the resource that I have, that what makes me, the best person to be able to assist this facility. Um, again, like I said, I like to be a resource, meaning that is I have a whole team behind me. When I can't get something in one place, it's a phone call away or a text away in a group chat we have to make sure we have,
Yep.
the proper information, the proper placing for that patient. Sometimes we may not be the best place for that patient. It might be insurance. It might be, the care that they needed. So knowing what's out there to be able to place the patient in the right facility, the right place for the patient and also for their family.
And that's what we talk a lot about. We are the experts of home health, not the primary care physician, not the podiatrist, not the orthopedic. They are expert at their craft, at their practice. I certainly don't expect them to know everything about home health. I certainly don't expect them to know everything about insurances. But I certainly do expect that we know everything about home health, that we know everything about insurances, so we can provide that value. Let me hold that pillar for you so that you can serve more patients and the outcomes can ultimately be better. So um, that's the key.
Of course.
What would you say is one of your biggest challenges 3 months in?
Is to after that normally with the roads we have a 30 minutes welcome call opportunity to be able to reach out to the patient when we receive the referral is to be able to get in touch with that patient.
Yes, you're the first voice.
Yes. So one of the things that one of our challenges is to be able to get with that patient once we establish contact, and that's what makes it easier for us to be able to continue with that care. So that sometimes is a challenge to establish that first contact.
And how, let's say you call somebody, you only have one phone number, they don't pick up. What do you do next? What does Paul do next?
Most of the time, I like to leave a voicemail and follow up with a text message, introduce myself via the text message. A lot of time, they tend to call you back because they realize you're not, salesperson trying to call them to. So with that allows me to be able to make that first impression, the first welcome call.
And that's why it's very important to us. And you work with a lot of some of our biggest hospitals, some of the biggest hospitals in South Florida. You work with those facilities. A lot of the times, the patients don't have their phone at the hospital. A lot of the times, the patient doesn't have their phone at their rehab, or they're of a certain age where there's no such thing in their life. They have a home phone number. Talk a little bit about being on foot presence, visiting those patients, making that bedside visit, and going above and beyond, because not everybody does that.
I agree. I, One of the patients that we did a bedside with, and after communicating with her, and we did the welcome bedside visit, and we had difficulty to finding her afterward. So of course, we are able to stop by the home, knock on the door, and find out that she didn't know where her phone was.
100%.
So then we were able to establish contact and to be able to make sure she had what she needs, and having our um, clinical team be able to assist her the best way possible there.
And Paul, last question. Is there anything that myself or our operations or the company as a whole can better do for you to help you better at your role or job, whatever you want to call it, passion, to better help serve the community and specifically the patients?
I think it's one thing we continue working on is communication.
100%.
And that's one of the things that I think with our team we're striving on is to
Yes.
keep on that communication. So as long as we keep talking, I think that we will see it with the benefit of our patient and for the community we're serving.
I 100% agree with you. Communication is key. My favorite, radical transparency. So we try to stay tight. Paul, thank you so much.
Thank you.
For taking the time. I can't wait to see you on the podcast a couple months from now.
I don't know. I mean, depends.
And all of you, thank you so much for joining us. We'll try to keep it fun and entertaining, educational, and just spread light and love around the home health community. So thank you so much for joining. We'll see you again. Please don't forget to like, subscribe, share, ask questions, call us, you name it. We're here for you and can't wait to see you again. See you on the next one.